I'm here with Tia Nielsen, and Tia's a surrogate from Maine, and she's got a husband and two delightful children. We're going to interview her and find out a little bit more about her children and how she feels about her surrogacy. Tia, what made you decide you'd like to become a surrogate for a couple who desperately want to conceive but cannot?
I really enjoy pregnancy, and every day that I wake up and see my children, I realize that there's couples out there that don't have the same joy that I do when I see my children. So because I have easy pregnancies, I decided that I'd like to try to help someone else since we're done with our family.
When you said you had easy pregnancies, what does that mean?
I felt great. I mean, I wasn't very sick. And with my youngest daughter, I was sad when I went into labor because I had hoped to be pregnant longer with her, even though she was past her due date. Mm-hmm. So I'm comfortable during pregnancy. I don't feel the urge to be done with it as soon as possible.
What are your values regarding surrogacy? How do you value the surrogacy, the process?
I think it's a very important process for families because there's always adoption, but not for your own biological children, and I understand how important it is to pass on bloodlines and family names with your own genetics.
Can you tell me a little bit about your family? Are you married and do you have children?
Yeah, I've been married for 6.5 years, 7 years in July. I have 2 daughters. Sophia is 4.5 and Elena is 19 months. Mm-hmm. And they are best friends, and it's never a dull moment in my life.
What's your husband's your husband's name, and can you describe how your relationship is?
My husband's name is Richard, and we get along very well. We definitely don't like to be apart. We have a lot of the same beliefs and interests, so we like to spend a lot of time together and as a family. You mentioned their ages and your children's names and their ages. Does your husband or your partner have any reservations regarding the legal relinquishment of the parentage of the child after birth? Not at all. We are finished with our family, and going into this, we know this is not our child. This is your child.
Have you ever been a surrogate before?
I have not.
Okay. Do you have a solid support system from your family and/or your spouse to help you face the feelings that may become overwhelming during the surrogacy pregnancy?
I do. My husband is supportive of anything that I want to do in life, and my family is supportive as well as his family. So we have lots of support.
Can you describe the maternal feelings you experienced during the previous pregnancies, and how do you plan to deal with those feelings as a surrogate should they arise?
I think being pregnant definitely raises some maternal feelings. However, this is not my child. I don't feel like I will feel maternally linked to the child, other than being a safe place for him or her to grow.
Have you ever experienced any complications during pregnancy, and if so, what were they?
No. I had 1 miscarriage, and that was it. So.
How do you take care of yourself when it comes to your health? How do you do that on a day-to-day basis, more or less?
We eat mostly organic and all-natural foods. We don't eat out very often, and if we do, we make healthy choices. I also try to get to the gym 2 or 3 times a week to exercise.
Okay. Can you describe your diet on a typical day when you were pregnant the last time?
The last time I craved fruits and vegetables, pretty much only. I had an aversion to red meat, and so I didn't eat a lot of red meat, but fruits and vegetables went out of style in my house.
Very good. As a surrogate, you're going to strive, you said, to eat healthy. And if you need to reach out for support, should you become overwhelmed or have morning sickness or for whatever reason, that may,
Is there people in your family who you can reach out to for help?
Of course, yeah. My mom and my dad live within a half hour of me. My husband's family lives a little bit farther away, but they're always available by phone or email.
Good. Should more than one embryo be implanted and all of them succeed, what are your feelings regarding fetal reduction or abortion if the couple's wish is to have no more than one child?
I feel like anything more than twins, and if it's advised by a doctor, I would be open to reducing. However, I don't wish to reduce from twins to a singleton.
Good. And would you be willing to, you're willing then to consider carrying twins to termination, to pregnancy termination?
Yeah.
Okay. Are you willing to work with the surrogate agency, the IVF doctors, and the OB/GYN doctors to take all the necessary tests and screenings to qualify and to travel out of state for procedures and operations if necessary?
Of course.
Okay. Are you willing to work under the instruction of surrogacy supporting staff to provide all the data and information that's required from the client and from the agencies?
Yes.
What kind of expectations do you have for your relationship with the IP couple after the baby's born?
After the baby's born, I feel like it would be completely up to them if they wanted to maintain a relationship, and if they prefer not to, that's fine with me also.
Okay. Would you expect to see a Christmas card every year and a photo of the baby?
I would like that, but I don't know if I would expect it.
Do you have a desire to have any future contact with the child as he or she grows into adulthood?
I guess that would be the same thing. If the parents and the child, if the child was an adult and wanted to meet me, absolutely, I'd be open to that.
Okay. Another sensitive issue is abortion and adoption. Abortion generally is not allowed in the ULAN's contract for services with the parent. We have consulted the intended parents clearly on this and asked them, and they've signed terms of service before ULAN took them into the program. But in the case the couple divorced, either one of them, or two of them passed away during the pregnancy, would you consider accepting an abortion?
No.
Okay. If the above-mentioned tragic events occurred and you do not want to do an abortion, would you be interested in adopting the child through an arrangement, an agreement arrangement?
Like myself adopting
Yes.
the child? I guess
Honestly.
it's possible, but we're done with our family and we're happy with our 2 kids, so we would want adoption by someone else probably.
Good. A lot of people will adopt. In the case that, then that's not going to happen to you. In the case that the newborn is found with defects, diseases, or disabilities to some degree, even though the intended parents are required to take the child, it is our job to ask you about your choice for the possible adoption of the newborn. Can you share how you feel about this? You just did do that. Do you feel the same way now on that answer? If there's a problem with defects or some disease or something happens to the baby.
Right, and that's after it's born?
After it's born, right?
Yeah, then
Same
it
thing.
would be the same thing.
Okay. Would you be willing to travel to China? Now, this is an outside chance, so this doesn't happen, but would you be willing to travel to China for a possible embryo transfer cycle procedure? If this is arranged, both male and female IPs had blood tests conducted in the U.S. You may be asked to go to China because some of our IPs have their embryos stored in China and cannot have them transferred to the U.S. The China Yuan contracted hospitals agreed to accept non-Chinese surrogates for embryo transfer procedures in the event that the child is delivered outside of China. In other words, are you willing to go to China for the transplantation procedures?
Yeah, if that's
Or you
required.
go to the Great Wall.
Sure.
Are you comfortable providing breast milk feeding for the newborn?
If they would like that, then yes.
Okay. And that's it.